Hi, my name is Todd from Queensland. Today I'll be playing the role of a Haru/CCP officer on Rescue 500. Approximately 2 hours on road from Brisbane, a gentleman on a construction site has had his head hit with a crane hook at high velocity. The sitrep from scene states patient is OSCE, agitated with significant isolated head injury. Hey guys, my name's Ben from the Chopper.
Hi guys, I'm Rachel. This is
Chris, nice to meet you. What do we got?
So 30-year-old Jim McDonald.
Yep.
No known medical history, allergies or meds.
Yep.
He's been hit in the right parietal, right orbit
Yep.
by a crane hook fallen approximately 30 metres.
Okay.
Was witnessed to lose consciousness and immediately collapsed to the ground.
Yep.
On our arrival, GCS 9, very agitated.
Yep.
Got a baseline set of obs, ECG sinus bradycardia on rate of 55, respirator of 18, stats of 98 on room air, temp 36.5, BSL 5.5.
Yep.
We haven't been able to get a blood pressure because he's far too agitated.
Mm-hmm.
We've put a collar on with his mate's help, and we've managed to get a cannula in, but that's pretty much where we're at.
Oh, fantastic. That's great. Have we tried a manual blood pressure?
No.
No, cool.
No, now we've got my hands in the
Chris, is it?
Yes, Chris. Yeah.
Chris, mate, could you get the colleague to take over from you there?
Yeah,
We'll get a manual blood pressure first.
Yes.
We'll follow that up with a... we'll get manual blood pressure and we'll follow that up with a spike a bag of fluids and we'll get 5 and 5 medaz. Thanks, mate.
Right, colleagues, now got patient.
Okay. So, alright. Looking for a response. Give us Jim a minute.
Yeah.
Jim, can you hear me, mate? Nothing there. Going for a thin finger nail bed. And we're getting some withdrawals. No, that's some localizers there. Okay, and a groan. Okay, yeah.
His eyes flicked a bit for you too,
there.
so
Yeah, excellent. GCS 9.
Yeah.
So, airway at the moment, Rach.
Yeah.
Happy with that?
I'm happy there's been no void in the airway.
Do you think you would take an OP right now?
No, I don't
think you will?
would.
Okay, sure.
You'll
You'll update me on that if anything changes. I'm going to have a listen to his chest. Alright, excellent. Equal air entry. Doesn't appear to be any bruising. Right.
180 on 100, mate.
180 on 100, thanks Chris. Abdominal's good. Pulse is good. Happy with that. Radials. Alright, let's have a look. So, hemostasis down here, guys.
Yeah, just a large boggy mass on the right parietal.
Yep.
And some swelling that's starting to affect the orbit.
No. And we've got some, no bleeding out of that here?
No, nothing out of this here.
Alright, now this one's really swollen, but if I... Yeah, there's no reaction there, quite dilated. That one there, a little sluggish as well. Okay. And no trismus at the moment? In the area?
No.
Excellent, okay.
Fluids primed and running.
Lovely. Go get the 5 and 5 medaz.
Yep, no problem.
Awesome. So, how you going there, mate, holding him down? It's quite hard, yep, no problems. Okay, so happy with the ABCs there. We've got a full set. He's hypertensive. At the moment, we're getting irregular resps. We're going to check, obviously, for any signs that we progress to Cushing's triad.
Midazolam.
Yep.
Indade, 5 and 5.
5 and 5, thank you very much. Okay, let's go. He's a young, healthy lad. Blood pressure was 170 over 100, is that right?
180, 100.
180 on 100. Can we go 2.5 straight away? Let's see if we can't sedate him slightly. Excellent. I'll give that a few moments. Chris, as soon as Rach is happy that he's settled a bit, can we get him straight on some nasal E2 CO2? In fact, we'll get him on 15 litres as well, like nasal. Yep. Okay, so I might come to the head now, Rach. So guys, I'm thinking the plan for him, it seems to be very isolated to the head, isn't it? Have we had a chance to check the back at all when he was...
Yeah, the back there was nothing.
Nothing there? Okay,
nothing.
Wonderful. Alright, so if that's the case, and we're happy there's no other traumas, I think an RSI is probably going to be right. We're going to RSI the patient, package him, and we'll take him up to Brisbane.
You like a warming blanket?
Oh yeah, that'd be fantastic, yeah. We'll basic cares and we'll also... Alrighty. What I'm going to do is I'm going to consult for my RSI. I'm going to require... So what we're going to do, guys, who's involved in an RSI here before?
Yep.
We both have?
Yes.
Yep.
Excellent, cool. So what we might do, Rach, you're primary initially, you happy to be my airway assistant? Yep. Lovely, and Chris, I'll get you on the drugs, mate.
All right, mate.
And you'll have to help me with some mils as well, because we are a bit worried about the high risk neck there as well. Okay, so I'm going to make a phone call. We're going to get, I think we'll probably most likely go a fentanyl, rocuronium and propofol infusion, but I'll just run that by the doc, okay?
Perfect.
So we've got this running 15 litres at the moment.
Yep.
Chris, you got pen and paper there, mate?
Yes.
I'll give you the rundown. Hey Doc, Ben from Haru, how are you, mate? Excellent. Look, out at Toowoomba, we've got the 30-year-old male, high velocity, isolated head injury from a crane hook. GCS 9, that's E2, V2, M5. Patient has remained GCS 9 throughout. He's got no other significant injuries at the moment. Hypertensive 180 on 100, bradycardic at 55. Other normal, everything else seems to be normal. So I'm thinking a fentanyl, propofol, rocuronium. What do you think? Are you happy with that? I'm thinking 2 per kilo for the propofol. Yep. Okay. So Chris, if you want to write this down for me, mate, we're going to go 140 of the propofol.
Yep.
Going to go follow that with 100 of fentanyl, sorry, and we'll go the 84 of rocuronium.
All right.
As per the 1.2.
Yep.
Excellent. Okay. Yep. Yeah. We'll have the aramine drawn up as well. Yep. Okay. Thanks very much. I'll update you. Cool. Okay. So, guys, here's the checklist. I think we'll get started on this. Thanks very much. Let's run through it together. So, Chris, you happy preparing those drugs, mate? Excellent.
Okay.
Yep.
So pre-oxygenation.
Yeah.
So we've got.
So let me just, before we do that, let's just do one more reassessment, sorry. I just want to see if we can start a better form of pre-oxygenation, okay? So, Jim, can you hear me? There's nothing there. Can you give me a painful down there on the finger? Okay. Just a little groan there, and he's now, yeah, would you agree that's a localising reaction?
Yeah.
Okay, cool. So 5, 2, 2. So it's still GCS 9, but it certainly has improved in his agitation. Okay, so let's. I might grab the bag valve as a starting. Thank you very much. We've got the PEEP attached.
Yeah.
Excellent.
So
I'm just going to
checklist.
give him some 100% at the same time, just assist his ventilation. Sorry, Rach, continue.
So for pre-oxidation, we've got a BVM with PEEP valve.
Yep.
CO2,
Yep.
which we need to get on.
Yep.
We've got an oropharyngeal airway.
Yep.
Which I'll pop next to you there. I sized that one up earlier.
Lovely, thank you.
Nasal problems with high flow oxygen, 15 litres, and we've got our oxygen supply. We've got a full bottle there. We've got another bottle in the other kit.
Yep.
So then assessment and monitoring, we've got a BSL within normal limits. We've
Yep.
assessed basic neurology. We've got ECG, non-invasive blood pressure, SpO2, and the CO2 all on the patient.
Excellent, thank you.
Chris, do you mind just grabbing that CO2? Here's the connection. So access, we've got a patent IV
Excellent.
that we can see with fluids connected and
Let's
flowing.
give that a
Happy
trial
with
run.
TKBO?
Yeah, let's just give that a trial run
Yeah.
now, just so
Okay.
we're happy.
Yeah.
Fantastic, that's great.
So we've got suction.
Yep, lovely. I'll get that under the right shoulder.
Yep, perfect. So and that's working, that's connected.
Yep.
So for equipment, I've set up for you, we've got 2 laryngoscopes. We've got, what size ETT were you wanting?
Can we get a, let's have a look, we've got approximately a 70 kilo male. It's got a size 7.
Yep. So I've got a 7 and I've got an 8 and a 6 as well.
Lovely, excellent. Now,
I'll check
just
the
on
cuffs.
that, we'll just assess the patient. At the moment, we've got, there's no beard, doesn't appear to be any issues with neck length. Should be quite an easy intubation, I'm hoping.
So I've got your bougie.
Yep.
I've got a 10mm syringe. I've got your tube tie, which will pop underneath the patient.
Yeah, lovely, thank you.
I've got an LMA, size 4, ready to go.
Yep.
Surgical airway.
Let's get a size 5 LMA really
Yeah.
just as well.
Surgical airway, and we've got the manometer.
Yep.
So position, we've got patient's position is optimised.
Yeah, unfortunately
And
we're
mils.
going to have to consider mils, aren't we? So
Yeah.
we're not going to have a great sniffing position. It's going to be grade 2 likely straight away.
Yeah. And
That's all right.
number 7, drugs. So we've got our induction agents.
Lovely. Just let me know what you got there, Chris.
Alright, so we've got the
Propofol. Yep.
220.
Yep.
The fentanyl.
Fentanyl, 110.
Yeah,
Lovely.
the rock.
Yep, perfect. That's
Yep.
have we got 84 in there?
Yep.
Yep.
84 in there.
Ah, perfect. Thank you. Yep.
And just Aramine.
Yep, lovely. We'll also just in cases, we'll get a adrenaline drawn up as well.
From
And while you got a little bit of time there, let's just get the post-sedation stuff ready as well. I'll get another 5 and 5 Nadaz
Yep.
and another 100 fentanyl. That'd be great.
And your last step on your checklist is to brief the team prior to the RSI.
Oh, thank you. How are we feeling, guys? Is there anything else that either of you can think might help the patient prior to this induction?
No, I think we've pretty much got everything that we need ready.
Lovely, good. Yep.
It's just going to be that C-spine is the biggest concern.
Yeah, excellent, good. So we'll consider that. Rach, are you aware of burp? Yep, excellent. Backwards, upwards, rightwards, and pressure? Excellent. Obviously, cricoid if I feel there's any sort of gag going on, but hopefully that won't be the case. Okay, lovely. So let's prep. Let's have all the drugs up ready to go. Chris, I'll get you once you push to take on the mils.
Yep.
So guys, we've been pre-oxygenating. I've had the timer going. We've had pre-oxygenating now for 2.5 minutes. I think we'll give it 1 more minute, and we'll also we'll give 1 more minute followed by the drugs. Okay. Let's get another set of vital signs,
Yep.
Chris. Yeah. Okay. That's 15 litres. We've got the nasal prongs running at 15 litres as well. Denitritisation of the patient.
180 on 95.
Lovely. And can we get that? We'll put the monitor back on. We'll put it on 1 minute blood pressures. Thanks.
Yep. 1 minute.
Yeah, thanks. So, Rach, it's been a while since you've helped with the intubation?
Not that long.
Not that long?
No.
Lovely. So, obviously, going to throw the booty down. I'll try and communicate as best I can as to the steps. I don't think there's any reason to rush. Obviously, we know what we're doing if we fail the intubation. Worst case scenario, we have got our surgical kit there, but we will just go back to reoxygenating the patient. We've got our LMA, and we've got our backup airways. Okay.
Yep.
Alright, so Chris,
Yes.
the order we're going to go,
Yep.
we're going to give 100 mics of fentanyl first.
Yep.
Happy for you to push that now.
It's 100.
100, lovely. Let's follow that up with the propofol. So this is 140, so we're going 2 mils per kilo for Jim. Yes, please.
Yep.
Lovely. Alright, now we'll grab the rock. We'll go to the 84. So patient's going up neck now.
Yep. 84.
Ventilating. Yeah, 84. We'll push that straight in. Thanks, mate. Okay guys, we're ready to go. Chris, do you want to come around?
Yeah,
Let's go from the front there. Just undo the C-spine collar. That's it. Lovely. Happy with that grip there?
Yep.
Excellent. Thanks, Rach. Alright. Aware of the mills going on. Left side of the mouth, sweeping the tongue. Watching for teeth in the molecular. Yeah, Rach, please. Lovely. Just nice and slowly. Wonderful. Still observing the chords at all times.
Passing you the tube.
Thank
I've
you.
got the bougie.
You've got the bougie. Sliding, giving it a little rotate to get past the lips. Looking to get between the two black lines. Rach, can you please remove the bougie? Fantastic. Our endoscopy out. Let's go 10 mils of air to begin with. Lovely. We'll check the manometer later. Fantastic. So what are we looking for here, guys?
Misting, rise and fall. Good
Lovely.
damage.
Manometer's positive.
Positive,
Yep,
fantastic.
good pressure.
Number one thing we're looking for, let's get those beautiful waveforms. Excellent.
Good rise and fall.
Yeah, lovely. Can confirm lead placement, that's six nice waveforms. Alright, let's have a listen. Rach, can you just take over there for a sec? Just remember that we're not tied in yet. So that was 22 mils at the lips in case I ask guys. Lovely, good position. Right, let's get that collar back on.
Yeah, secure the...
Yeah, let's secure it first.
Yeah.
Lovely. Yeah, I think we'll throw a bite block down the side there. Thanks, Rach.
So, Rach, you just grab the collar for me. It's just going to fall.
Yep.
Thanks.
So that's on 5 centimetres a peep. Yep. And that manometer came back with a positive reading.
Yep.
Thanks, Rach. So I'm going to pop him on the ventilator once we get into the chopper, but for now we're just going to try and maintain nice Sierra waveform, 35. Let's try and get the rate a bit further around, mate.
Yeah.
Yeah. But we'll try and keep that rate just a bit further this way. Yeah.
There we go.
That's alright. That's alright. Nice.
That section's still there.
Yeah, lovely. I'm very aware of the secretions, so let's just actually give that a suction now. Yeah, switch it on.
Yep.
Yep, that's good. That's great.
So do you want your post-RSI checklist?
Please, let's run through it, guys.
Yep, so appropriate sedation and analgesia.
Yep, so we have 100 mics of fentanyl,
Yep.
and we've also got 100 mics of fentanyl, and yeah, thank you, we've got 5 and 5 Medaz as well. Perfect. What we'll do, we're obviously looking for any signs of under sedation. I'm happy with how we are at the moment. I see any tearing, tachycardia, or any movement, obviously, we'll be going 25 mics of fentanyl to begin with.
Reassess vital signs.
Lovely, yeah, we'll get a full base set again. Thanks, Chris.
Cuff pressure assessed.
It has been, yeah.
And consider an orogastric tube.
Yeah, I think we will do that. I want to package this patient nicely before we get going.
Yeah.
In fact, to begin with the packaging, so we've got a warming blanket on, Chris.
Yes, we have.
Cool. Do you mind we'll throw in a second access on that other side.
Yep.
And yeah, I think we'll throw this orogastric down. Okay. Rach, do you mind taking over ventilation for a second? Lovely. So, measuring the xiphoid process. Okay. to grab a bit of tape in a moment, but first, thanks Rach. Let's pop this bag off. Thank you. So we're going to aspirate 50. Excellent, aspirate the stomach contents. Look at that. Thank you, I'll attach the bag. And I'll just need a 20mm syringe. Thanks, Rach. I'll take that from you. Lovely, switch up. Thank you. 20mm of air. Lovely. I'll just get you to tape that down for me, Rach. That's all right. Excellent. Thanks, Chris. That's great. All right. So once we package the patient, I'm going to pre-notify. Appreciate all your help, guys. It's been fantastic. Is there anything that we're forgetting at this stage? No, lovely. All right. Rach, do you mind taking back over ventilation? So I'm just going to give a pre-notification to the hospital. Hey guys, just the hot phone. Yeah, excellent. Ben here on the Haru and the chopper. Look, we're about 25 minutes ETA to you guys. We've got a 30-year-old Jim McDonald. Yeah, no date of birth at this stage. Jim's been, unfortunately, high velocity, high mechanism, isolated head injury with a crane hook to his right parietal and orbital region to his head. He has no other injuries, but is obviously collared for high risk. Patient's been RSI'd using a propofol, fentanyl, and rocuronium induction. Patient's being sedated currently with fentanyl. Look, he's going to come in on the ventilator, bilateral cannulas, and yeah, should be there in about 25 minutes. All right, thank you. Thanks, guys.
Thank you.